Sharon, can you hear me? Hello, Sharon?
Am I audible
Yes,
now?
you are audible.
Good morning. Sorry for the inconvenience. Good morning to all. First of all, thank you all for your presence and time. It's my pleasure to welcome you all to this webinar. Today's session is going to be led by Mr. Shabari Nayak. Recently took up the position of Labor Migration Specialist for South Asia, based in the ILO Decent Work Technical Support Team in New Delhi. He provides technical advisory services to 7 countries in the sub-region: Afghanistan, Bangladesh, India, Maldives, Nepal, Pakistan, and Sri Lanka. On behalf of Sri Shabarisha College and PG Department of Social Work, I welcome you, sir, to our program. Next, I would like to welcome our respected Principal in Charge, Professor Vijay Harish Kumar, to this meeting. Next, I welcome our faculties, Mr. J.M. and Mrs. Neeraj Raj, Ms. Babymol Assis. Finally, I would like to welcome you all to this webinar. Thank you.
Thank you, Sharon. Next, I would like to invite Professor V.G. Harish Kumar, Principal of Sri Shabarisha College, Kerala, for keynote speech.
Thank you. Our Honorable Speaker of this national webinar, Mr. Shabari Nayak, sir, the Labor Migration Specialist of International Labour Organization, South Asia, and Professor M.J., Professor in Social Work Department, and Mrs. B.V., and other important persons who are becoming a part of this webinar. And the people, students, professionals, research scholars, and faculties who are attending this webinar. All of you, welcome to Sri Shabarisha College, Kerala. Sri Shabarisha College is India's first aided arts and science college run by tribal management, Malay area tribal population. So the PG Department of Social Work, Sri Shabarisha College is organizing a number of webinars for the last discussing a very important topic. Impact of COVID-19 among migrant laborers. Nation. So a number of institutions to change this existing situation and to establish tomorrow. Today we are very happy because very eminent personality, Mr. Shabari Nayak, is with us for taking a very important topic, impact of COVID-19 among migrant laborers. Definitely, it will be an opportunity for the participants to analyze various problems faced by migrant laborers during this period, and also will get an opportunity to identify certain strategies to address the issue. Definitely, Mr. Sabri Nair sir can make some sparks or can impart some insights in the thinking of the professionals, students, research scholars who are attending this webinar. So the department is very happy for the presence of our resource person, because we feel that it is a great opportunity for the department to organize this webinar with the esteemed participation of Mr. Sabri Nair sir. So welcome, sir, to Sri Sabarisha College family. And I also congratulate Ms. Srikala to organize a very contemporary webinar during this COVID-19 period. So I wish participants a happy learning. Thank you.
Thank you, sir. Next, I would like to invite Shabari sir for session.
Great. Shrikala, can you hear me?
Yes, sir, you are audible.
Very good. I'm going to turn my camera on and let's see if you can also see me. Can you see me now?
Yes, sir.
Very good. Excellent. What a pleasure. First, of course, thank you very much, Professor Harish Kumar, for the invitation in the first place. I always appreciate being part of conversations that the roots of which go back to the state that I come from. And especially when it goes back not just to Kerala and the state that I come from, but also to the fact that the name of the college and the organizers of this webinar, Sri Sabarisha College, has a resonance with my name. So in a way, I think this is a great coincidence that Shabri has the opportunity to speak at a webinar organized by Sri Sabarisha College. I think that in itself is a huge pleasure for me. And more than anything else, may I also say this, and thank you, Professor Harish Kumar, for your introduction. I'm very glad that in your introduction, you mentioned about Sri Sabarisha College being one of the first colleges in India that is run by tribal management. I think for someone like me, this gives a whole new exposure to understand how a college such as yours is also run. It's only been about a year and a half. I heard Sharon say in my introduction that I was recently appointed. Well, that profile was written when I moved to Delhi with my posting with in January of 2019. So it is not recent anymore. But when I moved here, I moved here with moving from Geneva and New York prior to this, which is where my postings were. And now moving here, I've begun to recognize how much of importance there is with a whole range of conversations that needs to come from forces such as the management that runs colleges and institutions like Sri Sabarisha College. So in that sense, I'm very grateful. I recognize that most people here are Malayalis. So therefore, ellarikku ende namaskaram. Such a pleasure. I'm very grateful for this invitation. Thanks, Srikala, for reaching out to me in the first place. So really, I'm glad that we've been able to find some time for my participation here. Now, I understand that I have about half an hour to 45 minutes where we can engage in a conversation. And I prefer conversations because as much as I have examples and perspectives to give you from my own experience and from the perspectives that the International Labour Organization looks at these issues, I am sure that I will also have a lot to learn from your own experiences, from your own thoughts, thinking, and your own perspectives. So let's keep that in mind as we take this conversation forward. So don't hesitate. If there is anything at all, when I finish, don't hesitate to speak up. I think that is also the first sign for somebody who feels empowered. So I'm all for empowering, so don't hesitate to take the floor and ask me questions, anything that you wish. There is nothing that you cannot ask me. That's the first thing. The second thing, with regards to the process and the modalities, in terms of the substance of what I will be speaking to you about, is I will be focusing on two aspects of migration. The first aspect of migration that I will give you a background of, particularly vis-a-vis the impact of COVID on migration and migrant workers, is in the area of international migration. We are all coming from Kerala. Most of us do, at least. I see there are about 63 participants here. And I wouldn't be surprised if amongst us 63 people present here today, a number of us, in some way or the other, would be connected to somebody who has left the country, who has left India to help their families for a better life for their families. So I want to keep that in mind as we talk about international migration. The other aspect that I will also touch upon is the internal migration situation. And I think it is important for us to look at the issue in a holistic manner. So I will touch on both these topics. So let me start with international migration. You know, every time we talk about international migration, one of the first things that we need to be sure of are the numbers. The numbers with regards to how many migrants are actually there, how many international migrants are there in the world. Now, they say that as per the United Nations Department of Economic and Social Affairs, UNDESA, in 2019, released their official statistics for the number of migrants around the world. These numbers equaled to about 272 million migrants around the world, right, from different parts of the world. Now, out of these 272 million, if we start breaking that number down, you will hear that most of these migrants are actually migrant workers, people who have left their country to find a job, a livelihood, work in another country. So, out of the 272 million, as per the ILO estimates, the total number of migrant workers in the world, or labor migrants in the world, amount to about 162 million. Now, this 162 million, out of the 272 that I mentioned about, it's about 164 million actually. This 164 million out of 272 million migrants means that about 60% of the migrant population in the world are migrant workers, people who have migrated for work. That makes the issue of jobs, the issue of livelihoods, the fact that we want to earn a decent wage for decent work, and the fact that we will use this to support our families back home makes this one of the priority topics in the overall scheme of migration. Now, how do we go forward from there? Out of the 164 million migrant workers, now you must have heard Sharon in her introduction tell you that I cover 7 countries in South Asia. I give advisory services to the governments of Afghanistan, Bangladesh, the Maldives as well. These 7 countries together are 7 of the 8 countries that are part of what we call the SAARC community, South Asia Association for Regional Cooperation, or the SAARC. Now, within the SAARC, there are 8 countries. Bhutan is one of them as well, but Bhutan is not a member of the International Labour Organization. This is the reason why I cover the 7 other countries. So where does that leave us? When I told you that there are 272 million migrants, there are 164 million migrant workers out of that 272 million. How many of these people come from South Asia? So from just 6 countries in South Asia, which is Afghanistan, Bangladesh, Nepal, India, Pakistan, and Sri Lanka, those 6 countries alone, there are close to 50 million migrant workers. This number, if we say that close to 50 million migrant workers out of the 164 million come from South Asia, that makes South Asia the contributor to close to 1/3 of the global migrant worker population in the world. Therefore, becoming the biggest hotspot for labor migration in the world. So I want us to keep that in mind as we take these conversations forward. Now, within South Asia, we have India. The population of India alone is about 1.3 billion. How many of these people, 1.3 billion people, are migrating? So, as per the Ministry of External Affairs, the records maintained by the Ministry of External Affairs, which is the lead ministry for international migration, in the case of India, there are 17.5 million Indian migrant workers living outside India. 17.5 million. Out of in South Asia altogether, I mentioned 50 million. So that makes India not only the largest migrant sending country in South Asia, but also the largest migrant sending country in the world. Now, these numbers are important for us to appreciate what it is that India has to offer and what it is that Indians have to offer in the broader scheme of things when it comes to migration. I mean, how many of us coming particularly from Kerala have always heard, "Ee logathil evada chennalum oru Malayali undavu." Adippo moonilanengilum shari. When Neil Armstrong, they say when Neil Armstrong first landed on the moon, there was a Malayali chayakada. And the Malayali was ready to serve Neil Armstrong tea on the moon. And that's the speciality of the conversations when it comes to India. And within India, then, the biggest number of migrant workers have always come traditionally from Kerala. Most of them going to the Middle East. So out of that 17.5 million, where are most of our migrant workers? More than half that population, so about 9 million migrant workers from India are working just in the Middle East. That includes the Gulf Cooperation Council countries. So with these numbers, you can now recognize the importance not only that migration has for India, but the close relationships that we have built as India and as Indians with our neighboring countries in West Asia, that is particularly the Middle East. All right, that's your numbers play. Now, when we move away from the numbers and looking at COVID now, when COVID hit us, there was a whole range of issues that affected us, right? What's the first thing that we saw? When we heard of COVID, we first think now mask. When we think of COVID, we think of social distancing. When we think of COVID, we specifically focus on the health of the person. We specifically look at issues that relate to older people. If older people are not keeping well, and not just older, but older or younger, but more generally speaking, older people are affected, then it could be fatal. It could lead to death. So COVID is a crisis, is a health crisis that has affected us almost 100 years or more than 100 years after such a pandemic. The last pandemic to affect the world at large was the Spanish flu. And the Spanish flu was in 2018. In 2018, you had the Spanish flu where millions of lives were lost. And then in 1918 we had the Spanish flu, and now in 2020 we have the COVID-19, the coronavirus pandemic. So imagine in the last 101 years, not many people have into consideration the role that such a pandemic can play in our lives. In fact, ILO is one of the oldest UN organizations. The ILO was established in 1919. Last year, the ILO celebrated its 100th anniversary. So, I work for an organization that is over 100 years old. But even my organization has only now begun to understand the dynamics with regards to such a big pandemic. So, how does that affect India, which has just the 74th anniversary as an independent country? So we need to keep this in mind as we take this forward. But why is it that I specifically mentioned about how we look at COVID? Because we looked at COVID as a health issue, as a health crisis, we somewhere along the line forgot that health is wealth. If you do not have good health, you will not be able to generate the necessary wealth. And the reason I mention this is because for wealth, you need jobs. So what in turn, I see that Joseph M is presenting, and I can hear an echo in the background. Joseph, would you mind muting yourself? Shrikala? Or any of the organizers, could you kindly request everybody to mute? Thank you. Appreciate that. Thanks, Joseph. So I was coming back to the fact that COVID is more than a health crisis. COVID is an economic crisis. COVID is a jobs crisis. And COVID is specifically a livelihoods crisis. So we have to connect the fact that if it affects our health, it affects our economy and vice versa. Now, within that context, just in the Middle East, in fact, in June this year, a few months back, the ILO released a report of the way jobs are affected in the Middle East. And as I said, most of the Indian migrants, over half of the Indian migrant worker population, close to 9 million, are living in the Middle East. With this report, the ILO concluded that close to 8 million jobs in the Middle East will be affected. So that is a big number. So who are the people who are first affected when the jobs are at risk? The first people they say to be fired and the last people to be hired are migrant workers. And as a result, we saw migrant workers being put in the most precarious of situations. What kind of work are most of our Indian migrant workers involved in? Most of our Indian migrant workers are actually involved in sectors like the construction sector. So they are in low or semi-skilled categories. They are working as scaffolders, as painters, as welders, as carpenters. Now, the problem is that these are not low-skilled jobs necessarily. But in our country, we are used to saying that if you're not an engineer or a doctor, then everything else is basically low-skilled. Well, that should change. But at the moment, these are the people who are mostly migrating. It's in these sectors that most people are migrating to. Therefore, it makes it very vulnerable for them. We hear of stories in the Middle East where people, 8, 10 people, are cramped together in one room that is about 8 by 8 in size. How do you expect social distancing to be maintained when people are in these kinds of living conditions? How do you expect the virus to not spread when people are living in these conditions. And we can hear similar parallels. We can draw similar parallels with regards to internal migrants within our own country. But that's a different thing, and I'll come to that soon. But when we talk about international migrant workers, as a result, a lot of them started to lose their jobs. And losing their jobs meant that they had no other place to go. They had to come back home. So, because of COVID and because of the fact that our Indian workers were losing their jobs, the government of India, led by the Ministry of External Affairs, organized perhaps the biggest repatriation ever seen in the history of this world. And that repatriation process is what the government of India called the Vande Bharat mission. The Vande Bharat mission so far has brought back over 1.2 to 1.3 million people. So over 12 lakh people have come back to India. A lot of them coming back to Kerala as well. And majority of those people are coming back from the Middle East because they lost their jobs. Now, this makes Vande Bharat mission, as I said, the biggest repatriation exercise that the world has seen. But how do you repatriate a person when that person has lost a job, but the person is expected to pay for his own air ticket? So I don't have a job, but I have to buy my ticket to be able to come back to my own country. How do you expect that person to come back when he or she has not been paid their wages? A lot of companies in the Middle East, because they started losing out on contracts, they started laying off workers. And when laying off workers, they said, we don't have money to pay you your monthly salary. And because they didn't have are not able to pay their monthly salary, the workers were not able to send back their remittances back home. And not being able to send back remittances back home, they are also coming back to a country which we are already struggling. We hear every day when we open the newspaper, when we turn on the news channel, when we listen to the news on the radio, the first thing that we hear is that the situation of the economy in the country and the livelihoods and jobs are extremely severe and bad. If that is the case, what jobs are they going to come back to? They are coming back to a situation in our own country which is equally distressed. In that sort of a situation, you're talking about repatriation. If, as a migrant worker, I first face problems, which is the place that I will go to? So let us say I am a migrant worker. In fact, I was the son of migrant workers. My parents, my father went to Qatar, to Doha in 1975. And he came back 32 years later in 2007. But at the time, he never had to worry about these issues. But today, a migrant worker who has experienced COVID and job losses, who do you think that person will first go to to consult for an issue with the government in Qatar? The Indian migrant worker will first go to the Indian embassy. So the Indian embassy is the one that takes the lead in registering people as to saying, you can leave, you can priority that you should leave, and so on. Therefore, the role of the embassies become very, very critical. That is specifically in the context of repatriation. As I mentioned, they're coming back to their own countries. Particularly in the case of India, when they come back, how do you expect them to survive when they don't have a job here, when they're not able to necessarily find a livelihood option in their own country? Therefore, how do you expect an effective reintegration of migrant workers? But reintegration is not just jobs. Reintegration is also social. You know the number of stories we have heard We would have seen it all in terms of the news articles around there with regards to how migrant workers who want to come back to their country, but the moment they come back, they are treated as if they are the carriers of the virus. They are treated in a discriminatory manner. By who? By their own people. Now, I don't know how many of you have had families or family members coming back from the Gulf or anywhere else outside of India when they come back to the country. How is it that you have reacted? Have you been scared of them? Have you been worried that these people could be bringing the infection home and that you could be affected or your family could be affected because of these people coming home? Well, if that is the case, then that was not the right thing to do. So integration and reintegration of our own people back into their communities is not just about jobs and livelihoods. It is also about social issues. It is also about the way they are received. You know, the best place to understand how migrant workers are treated is by going to the immigration counter in the airport. I am sure many of you would have traveled. And if you have not, that is the first thing you will encounter is the immigration counter at the airport, where they will check your passport and your visa. If you're welcomed with a big smile on your face, that is the beginning of a good reintegration process. If you're welcomed with difficulties, then the reintegration process overall is also going to be difficult. Now, that is in the context of reintegration. A lot of these migrant workers are coming back with skills, with specific skills. These skills range from, as I said, some could be a carpenter, some could be an accountant, one could be an engineer, one could be a welder. It doesn't matter what, but they are coming back with skills. How do we make use of these skills? These are people who are not just individuals. Who knows, perhaps they have done work in building the biggest tower in the United Arab Emirates, which is the Burj Khalifa. So if you have been in Khalifa, the biggest tower in the world, the most expensive, one of the most expensive places to live in or to even eat out at, they are coming back with the experience of having been a part of building that tower. How exactly can we make use of those skills when they come back to our country? So therefore, it requires reskilling, upskilling, redevelopment of their skills, and for us to be able to make use of those skills in our own country for the development of our own country and our own state. A lot of these migrant workers, you would have also heard, when they reached that country, usually the stories that we've heard are people saying, "Sir, I went to the Middle East. I went with a visa. I signed a contract that said 500 Qatari riyals. When I reached there, my contract was changed and I was given a contract for 300 Qatari riyals. I went there as a welder, but when I got there, they asked me to be a cleaner. I went there as a driver, but when I got there, they asked me to be something else. I went there," a woman will say, "I went there to take care of the children, but when I got there, they asked me to clean the house." There is a difference with regards to all of this. But the reason I mention that is because of this. A lot of people became irregular. Irregular means that they did not have documents, that their documentation was not right. The fact that these people ended up in these precarious jobs, these very dangerous jobs, also meant that they would sometimes try and run away from those jobs. And a domestic worker, a woman domestic worker who is working in somebody's house is being abused by the employer. That woman will most probably will not be able to take it anymore and run away. The moment you run away from that house, you become an undocumented or irregular migrant worker. That is in the case of those people. A lot of migrant workers are in situations where their visas are not renewed, where their work permits are not renewed, their passports are confiscated by the company. then in that case, these people end up in situations where they become irregular. Now, because of COVID, such people have become more vulnerable than the regular migrant worker. And we saw a lot of this happening. A lot of countries, so particularly two examples, the United Arab Emirates and Kuwait, introduced amnesties for migrant workers to be able to get irregular migrant workers to be able to register themselves so that they did not have to necessarily fall under the radar, so to say. Now, why do I say that? Does it matter? I see in my screen a whole group of people. I see Maria Shaji, I see Madhusudanan Sundareshan, I see Kishore Abraham, I see Shifa J, Suchitra P, Joseph M, and a whole range of people. Now, you're all sitting together. You may all be coming from different perspectives in life. But if one of you gets the virus, the chances are that it will spread to all of you. It doesn't matter what background you come from. But the reason I say that is exactly this. It does not matter whether I have a passport or not. It does not matter whether I have a visa or not. If I get the virus, then whether you are rich or poor, black or white, from the developed country or developing country, if we come into contact, the chances are that I could also give you that infection. So therefore, my safety is equally important to your safety. The safety of an irregular migrant worker is as important as the safety of a regular migrant worker. So therefore, the irregular issue is something that we have to keep in mind. As I said, a lot of these migrant workers are coming back without having their salaries paid. What will they do now? You know how these migrant workers left in the first place? They left because somebody said, here is 10,000 rupees, go and pay that that recruitment agent who will help you, who will help your recruitment to a foreign country. Where did I get that 10,000 rupees from? I got that 10,000 rupees from a money lender who I borrowed the money from. And that money lender now is asking me, where is my 10,000 rupees? I have lost my job. I have not been paid my salary. And now I have to pay that person 10,000 rupees. Where am I going to get that money from? So the issue of wages lost, wages not being paid is an important issue for those migrant workers who are returning. And that brings me to my final point with regards to recruitment, the overall issues pertaining to recruitment. Now, this is all in the context of international migration. How does this now link to the issue of internal migration? Let me once again point out to the figures, the numbers. As per the 2011 census, there are close to 455 million migrants within India, as per the 2011 census. The census in India is taken every 10 years. So the 2011 census says 455 million. You know, out of this, how many are women? More than 300 million are women. And only about 155 million are men. So most migrants are women. Now, the reason I mention that this is important to keep in mind is because we are still living in a very patriarchal society. If we move as a man, my wife will move with me. So most women have moved because of marriage. Most women have moved because of a situation where they are forced to move. Now, looking at it. But then a lot of women have also migrated for work. Anyways, let's keep that aside. Where do we currently have the situation? Out of the 455 million odd migrants, the 2011 census says that there are only 41 million migrants who have said that they migrated for work. അതായത് 4 കോടി. Only 41 million migrants have reported to have migrated for work. There is a problem because Out of 455 million migrants, if we say only 40 million or over 40 million have migrated for work, then there is a severe underestimation of the numbers here. And this is also now accepted by the government of India. COVID struck when the lockdown was issued, when the order for the lockdown was given, immediately people started walking back home. And we saw just in the trains, in what they call the Shramik trains, more than 97 lakhs, close to 1 crore people moving back to their homes. 1 crore people, that alone is close to 10 million people. So this is just in the context of those who went back home and the numbers we have from train services. What about the others who are walking back home? So we are in a situation where we have to recognize the fact that one of the biggest issues we have is the fact that we don't have good numbers. We don't have data for these issues, particularly with regards to migrants. Today, when we open a newspaper, everybody will see in one column, there will be, this is the number of COVID cases in Kerala. This is the number of COVID cases in Maharashtra. This is the number of COVID cases in Delhi. So we are able to put the data for COVID cases, but we are not able to put the data for migrant workers. There is a problem there. And that is something that we all need to get together to address jointly as a whole of society. Like Professor said, like the principal said, it is about working as whole of society. Now that is specifically in the case of internal migrant workers, the numbers. But moving beyond in terms of the internal migrant workers, what kind of situations have they faced? A lot of these migrant workers are going through situations that we have also heard about, but we have not necessarily recognized as being important enough to address right at the beginning. What were these situations? A lot of these migrant workers were extremely affected by occupational safety and health. They were living in conditions where they were living in factories. Imagine you're working in cleaning up a factory and you're living in that factory. You're breathing in the fumes of the hazardous material in those factories. So just the occupational health of these migrant workers were also affected. A lot of these workers had very poor access to water and sanitation issues. When you have poor access to water and sanitation issues, how do you expect these people to wash their hands, to clean themselves, to take care of not having the infection? A lot of these migrant workers had poor access to housing. How do you expect these people who are living in slums or have rented rooms for 10, 15 people to live in one small room, how do you expect them to not get the virus? A lot of these migrant workers had limited social protection. Social protection meaning they were not getting access to health insurance. They were not necessarily getting access to welfare funds and a whole range of those issues which affects their ability to keep the virus away from them. A lot of these migrant workers did not have access to public distribution systems. A Bihari working in Kerala could not access the ration card because he has to access his ration card only when he goes back to his state. So now the government has introduced one nation, one ration card, which is, I think, great. But it has come at the expense of so many migrant workers already suffering because of the fact that they did not get food at the right moment and at the right time. A lot of these migrant workers were suffering from forced labor. They were in situations where a lot of these men, women, and children who had migrated were in marginalized communities. Who are these migrant workers? Where do they come from? A lot of them already come from very low socioeconomic backgrounds. A lot of them come from the Adivasi community, come from the Dalit community, come from scheduled caste, scheduled tribes perspectives. So within that category, they're already coming from a lower socioeconomic setting, because of which they are also struggling further with regards to gain access to justice. A lot of these migrant workers are also, as I mentioned, women, and women are equally, if not more, affected. Think of that woman. Think of that man who does not have to go through abuse, but think of the woman in the same workplace who has to go through abuse. Think of all those migrant workers who have bad financial insecurity. Their wages are not being paid on time. Now, these are issues which I also mentioned in the category of international migrant workers. So what is the similarity? The similarity is that whether you're an international migrant worker or internal migrant worker, the problems you go through are very similar. The degrees of how it affects you may be varying, but the problems are similar. And therefore, we need to look at these issues in a similar manner. I will conclude now because I need to hear from you, and I think I have taken way too much of your time. It is important for us to look at various things. So let me then conclude with some specific recommendations. When we look at the issue of migration, we have to recognize that most people are leaving because they don't have the economic opportunity, as I said right at the beginning, or because they say, I saw somebody whose daughter got married in a very big manner. I also want to be able to give my daughter a good marriage. I see that somebody has a washing machine in their house. Even I want a washing machine in my house. I see that somebody's children are wearing good clothes. Even I want to give my children good clothes. There's nothing wrong with that, no? That is the aspiration for every human being. And so a lot of human beings migrate because they aspire for a better livelihood, a better living condition, and to be able to do better for their own families. Now, within that context, can we make it easier for them? Yes, we can make it easier if we say that the focus should be on decent work at home. If we provide people the same opportunities at home for jobs, then they will not be forced to migrate. That would be my first recommendation. Let's focus on decent work at home. The second recommendation that I would try and make is the importance of all actors coming together. You know, we always say in the UN system, we talk about a whole of government approach. What is the whole of government approach? The ministry that is responsible for migrant workers' jobs is the Ministry of Labor. The ministry that is responsible for ensuring safety and security is the Ministry of Home Affairs. The ministry that is responsible for bringing back international migrants is the Ministry of External Affairs. The ministry that is responsible for women and children's development is the Ministry for Women and Child Development. So all these ministries in some way is involved in these different issues. I mentioned about skills. There is a ministry for skills development in our country. So all these ministries should work together. And that is important for a whole of government approach. However, the whole of government approach is also incomplete if there is not a whole of society approach. There are 65 people currently on this webinar. Can all 65 of us today take a decision that we are going to change the way we think about migrant workers? How many of us as Malayalis today we say, Hindikarananu vannittu nammada joliyokke eduthathu. Bengaliyanu vannittu ivada crimes muluvan nadathunnathu. How many of us think that way? And if we think that way, then let's change that, because that will be the beginning of a whole of society approach. So the whole of government approach goes hand in hand with the whole of society approach. My third and my final recommendation is this. Either migration conversation, either political conversation, we need to always think about the legal frameworks. We need to always keep in mind the laws and the policies that are existing. So the focus should be in ensuring that any law and policy that is framed should be framed by keeping the people at the center of the discussion. How many of you have taken the opportunity to read a law? A law, forget the law, read the Constitution. A lot of us would say, but we don't understand it, sir. It is so difficult. The language is very difficult. Maybe. That is also a change that we need to bring. We need to be able to explain our constitution, our laws in much more simple manner so that the people of our country understand that. Because not everybody is a lawyer. I am not a lawyer. It takes me something 2 times to read before I can fully understand it. But what that also means is to put a legal framework in place, we need to have good labor standards. And the labor standards should not be diluted at the expense of a worker's life. The labor standards should instead be strengthened. The labor standards should instead be elevated. And the way to do that would be in a whole of society approach, that everybody is involved during the defining of the law. That trade unions, that employers, government, civil society organizations, everybody comes together in the definition of these laws and labor standards. That would be a very important factor in which we can support migrant workers when it comes to their life, their own perspectives, and their aspirations for wanting a better life for themselves that each one of us want for our own families. I'll stop there. Thank you very much. And I'm very happy to take any questions that you may have. Thank you. Shrikala and Principal, over to you.
Thank you, sir, for such an informative session. Now it's time for clarifying your doubts.
Don't hesitate. Either you understood everything that I said and you thought it was perfect, or you thought, I didn't understand a word of what he said. It is actually better to not understand a word of what I said and then ask me questions, right? So don't hesitate, because there are no stupid questions, there are no stupid comments. As I said, I will learn as much from you. So feel free to interrupt and say whatever it is that you feel like.
Participants can use your chat box also.
Okay, I see a question from Mr. Madhusudanan Sundareshan. Madhusudanan, would you like to, take the microphone and go ahead and say what you have to say?
Yeah, sure, sir. Thank you.
Yes, loud and clear.
Thank you. Nowadays, people talk about reverse migration. So, how this reverse migration would affect the operations of ILO, or what ILO has taken as it has thought about the reverse migration in India? I want to have a clarification.
Sure. Thank you very much. I think that's a very important question. Look, reverse migration links into the points that I was making about reintegration. How do you expect reverse? Now, again, reverse migration, terminology like that is terminology that we use to capture the attention of policymakers. But what do we mean by that? It is basically people going back home. It is people going back to the communities that they come from. For that, one of the first things that ILO will say is, how do we ensure that the states to which these people are going back to have set up certain perspectives to ensure that these migrant workers are returning to a safe and comfortable situation. So for instance, a lot of migrant workers, let us talk about Kerala. A lot of migrant workers are coming back to Kerala, either from outside the country or from within the country. And if they are coming back to Kerala, then what kind of issues has the government put in place to make sure that these migrant workers are cared for? So, for instance, do they have the right quarantining facilities? Do they have perspectives where information is given to them about how best to socially distance? Do they have opportunities where they are told, okay, these jobs are available in our state in the district that you come from? Let us say somebody is coming back to Malappuram. Let us say somebody is coming back to Thiruvananthapuram. Let us say somebody is going back to Kannur. How do we ensure that these people who are going back to their respective districts, and within those districts, what kind of rules and regulations can be set in place to ensure that these people are taken care of, not just at the social level, but also at the economic level? Some of these districts in Kerala, we have 14 districts. In each district, the level of development is very different, right? Alappuzha is the development level is very different from the development of Kozhikode. So we need to recognize that each one of these districts have to, the people in each one of these districts, so not only at the state level, also at the local level, not only at the district level, but also at the panchayat and the local self-government level. We need to be able to address these issues at all these levels. So in a way, Madhusudanan, it's really a broad answer to a very specific question from your side, saying that government has to establish these perspectives at all levels of governance. I heard somebody else come in. Anybody else?
Sir, your recommendation was very innovative. Decent job in home. It was very. Some migrant brothers are living in our location also. I think while they are working in industries or other settings, proper COVID prevention mechanism is not practically followed by them, and it leads to report of COVID-19 in their residence. And I think in Anyway also it developed as a big issue. What are the measures you can put up for managing the same?
No, excellent question, Principal Harish. It's again very different in the way we perceive it. Now, when you say the COVID measures are not followed by the migrant worker, we have to also understand the fact that these migrant workers don't know what measures are there in the first place. Okay, I'll give you an example. My father has not been keeping well for the last couple of years. So I take him to the hospital here in Delhi. You know where most of the nurses come from? Most of the nurses in this hospital in Delhi come from Kerala. But when you speak to those nurses, you can start understanding that one of their biggest problem is language. They are not able to speak in Hindi. They either speak in English or Malayalam. If they have been here for a long time, they understand Hindi and they're able to communicate in some Hindi. But the point is, for any of our migrant workers who are moving either within the country or who have moved outside the country, one of the biggest issues is language. Language hampers the ability for a migrant worker to be able to take care of themselves. So therefore, now I know in some districts in Kerala, I know that even the church prayer happens in Hindi. Or it happens in Assamese, or it happens in Bengali. I think that is fantastic. I don't have a problem with that. Because in Delhi, I can also go into a church where the conversation is in Malayalam. I can go to the local Guruvayurappan temple here, and I know that I will find Malayalis there who can talk to me. So the point that I'm trying to make is that language is an important barrier if it is not addressed to effective occupational safety and health, and to address measures with regards to addressing COVID itself. That is one. The second thing is, a lot of these people are in very, as I said, the accommodation that is provided to them is very, very dire. It's in a very bad situation. So what role does the employer have to make sure that the accommodation is in a socially distanced manner? But at the same time, we have how many? I think we have over 20 lakh over 15 lakh migrant workers in Kerala. 1.5 million migrant workers in Kerala. ഇവർക്കൊക്കെ എവിടുന്നാണ് എല്ലാവർക്കും ഓരോ റൂം എടുത്ത് കൊടുക്കുക? But that's my point. Is if we want these people to work in our state and do the jobs that we as Malayalis are not ready to do in our own state, then we should be able to provide them with certain accommodation, working and living conditions that will suit their situation in times of such crisis. These are just two examples, but I can go on principle. There are quite a few such examples that we can give to make sure that migrant workers are able to address COVID in the right manner for their own safety and for the safety of others. I see that Kamala has asked a question with regards to migrant workers from my village came back to native places. Kamala, why don't you take the floor? Go ahead. Turn the microphone on and say what you have to say. And it doesn't matter what language you would like to speak in. Kamala? Is Kamala V there? Okay. So if you're going to be hesitant to take the floor, let me try and once again read your question and look at it specifically. You say migrant workers from my village came back to native places by walking during lockdown, and now again they are going back to work. What changed now and then? Excellent. Very good. What changed then, why they had to come back, was because they did not have anywhere else to go. Right? The companies closed down. Because the companies closed down, they were not getting their salaries. Because they were not getting their salaries, they had to think, who will take care of me? Who can I go to? My family is back home in Kerala, or my family is back home in Bihar, and my family is thinking, what do I do? Therefore, how do we take care of this fellow? How is this migrant worker able to take care of himself? Is he somebody's brother, somebody's father, somebody's sister, somebody's son, somebody's daughter? Therefore, that person says, let me then go back. So therefore, they decided to come back. But how do they come back? They don't have the train. They don't have a bus. They don't have a car to come back in. So therefore, they walk. Okay. Now, that's what happened to them. They came back. They came back and realized, what do I do now? I still have to feed myself and my family. So now they decided, we have to look for a job. Where do we look for the job? We look for the job in the same place where we are now. Let us say they came back to Kerala. They have to look for a job there. But either there are no jobs, or they don't have the skills for the job that is required there. So they say, okay, let me go back to wherever I came from. Now, that is the situation. But when they want to come back, now employers are saying, maybe we can try and resolve the situation without having all these workers. So there is one. The other is, a lot of migrant workers are also saying, maybe we don't want to go back now. We will be desperate, but we don't want to suffer what we have suffered. So there are two kinds of situations, Kamala, and I think it is important for us to recognize how each one of these situations affect migrant workers in different ways. I see Anshad Kolatur. He says, sir, my research area is reintegration of returned migrants from Gulf. Sure, Anshad, feel free to go to Shikala. She has my email address. Don't hesitate to send me an email, and I'm happy to answer your questions. I think I missed a question right at the top, even before Kamala, and that was from Anaga. Anaga said, what are the psychological issues among migrant workers? Psychological issues. I mean, you know, the first psychological issue that my father faced when he went to Qatar as an international migrant worker was the fact that he had to stay away from his family. Then my father got married. And even after marriage, he stayed for about 7 years without his wife and me. The reason I mention this is because that is the beginning of a psychological problem. When you're not with your own families, you grew up with them. You know, we come from a cultural background where our families are very important. Now, in that kind of a situation, imagine the impact it will have on us if our families are not there for us, or if we are not able to take care of our families. My father came back to Bombay, where his mother was living, and she died just as he came back. He came to know that she was not well, and therefore flight out from Qatar, came back to Bombay, and the moment he arrived, she passed away. Imagine the impact that would have left on my father. That is one psychological problem. The other psychological problems are many. For instance, if I'm not paid my salary on time, imagine there are people at my home who are waiting to receive the money that I send them so that they can take care of their children, so that they can take care of the health of the family, so that they can take care of the education of the children, so that they can provide for food on the table. Imagine the psychological problem that I as a migrant worker will face if I don't send that money back. Imagine what my family will face. Think of those women migrants. Think of the woman who has been sexually abused by her employer, who has been physically abused by her employer, who, or not even by her employer, has gone through that situation. Imagine the trauma that she will go through. And I think those are issues that we cannot resolve over a conversation such as this. It requires a broader range of thinking. But that is just the tip of the iceberg with regards to what the kind of psychological issues migrant workers face. I see some other questions here. I see a question from Raju. Migrant people in the government, which are policy? I don't understand your question, Raju. So feel free to either step in, turn your microphone on and ask me a specific question, or you can try and rephrase that question. I see a question from Danya Prakash. Is it true that the number of COVID-19 victims has increased after the coming of migrants? I don't know, Danya, but I am not going to come to that conclusion. The reason I say that is because exactly what I was saying before. The thinking is that all the problems are being brought home by migrant workers. Yes, there is a risk of infection spreading because somebody has come from outside. But no, I will not say that migrant workers are the cause of this issue, or the migrant workers are the reason why COVID-19 cases have gone up. I will say that the reason why COVID-19 cases have gone up is because there were no proper institutional support and health support to any of the people in the first place. That there was no proper quarantining, there was no proper social distancing, there was no health measures like wearing a mask. These are issues, these are the things that lead to COVID-19 spreading, not migrant workers. I see Pushpa Kumari, migrant workers, psychological issues. I mentioned about that. Rennie sir, good to see you here. Always a pleasure to have you as well. I learn a lot listening to Rennie Jacob as well. I see Pushpa here. No, Kamala also said, Kamala, I think you're very good at putting up questions, but I want to hear your voice as well. No? You say, as corona is a communicable disease, why people are moving here and there? Can I think that we are afraid much severity of COVID-19 as it really has? Kamala, we should not think about it that way. We should not think about why people are moving here and there. What do you do with the migrant worker then? Who is the person who's cleaning the streets in Kerala? Not the Malayalis. It is the migrant worker, most probably from Bihar or Uttar Pradesh, who's cleaning the streets. So we need somebody to do that job, but we have a problem with having them there. Then that's the problem. We need to change our thinking on such issues rather than anything else. But that's my way of looking at it. And I think we can all do that differently as well. Okay. Good. I mean, we've had some good questions and I've really enjoyed answering these questions. It's also been interesting for me itself. Anything else? Only Madhusudanan sir had the power to take the microphone. I don't see anybody else taking the microphone. I see now a question from Shibin saying, government implement various policies to improve conditions of every individual in the country. Government always say their project reduced poverty and improved their lives. Is the statistics show that government policies are failure? In your opinion, how can we say the government have no role on migration?
Hello.
I'll say this.
Shabari sir?
Kamala, I hear you. Let me quickly answer Shibin's question and then we can, you can take the floor. Look, Shibin, I like the way you.
For my question, I want to ask my question.
Kamala, let me finish.
Actually,
Kamala, one second. Let
okay.
me quickly answer Shibin's question, and then I will come to you. Okay.
Okay.
Question from Shibin about, does the statistics show that government policies are failure? I will say that the statistics show that the government policies can be strengthened. I will not say that it is a failure. Now, there are two ways of reading it. Either people can say this is nonsense, that I'm being very diplomatic, or people can say that, I'm not necessarily answering your question. I do believe that every government has its limitations. A government can only do what is right based on how people also contribute. As an example, let me ask you this. The government policy for cleaning the road is also by putting a dustbin on the side, a garbage bin. How many people see that garbage bin or side instead of throwing it into that garbage bin? So the point I'm trying to make is government policies alone will not be helpful for the situation to be better. People have also got to follow the law. I'll give you another example. I have currently decided to buy a bike, but I need a license to ride the bike. Now I'm thinking, Ishara, license? Should I pay somebody to get the license, or will I be able to get the license in a legal manner? Now, the right thing to do is to go the legal route to make sure that I get the license. But the government policy says that that is the route I have to take. It may take me longer. But the point is that a lot of these government policies in place are also not necessarily being followed by the society. That is why I said any issue should be solved not whole of government approach, but in a whole of society approach as well. Okay, but Shibin, this is a very important question. I will not deny it. There are always failures. The important issue is to also say, how do we correct it? And different governments have different capacities in the way they correct these issues. So I hope that our governments, state or central, is doing the right thing to correct these issues if there are any flaws in those issues. Okay. I think, Kamala, you wanted to come in. Why don't you come in? I hear from you, and then we go back to the principal, because I'm already 15 minutes overdue. Go ahead, Kamala.
Yes, sir. My question is relevant to my previous question. Mm-hmm. So, about that people here moving here and there, I asked them. Mm-hmm. What I'm trying to say is, during lockdown, people, I tell you one example of one case. From last 4 years, one of my relatives, they are staying in Hyderabad. After lockdown, they are coming back from Hyderabad. So during that lockdown, staying that time in Hyderabad, and suddenly why they came during this Corona situation. So these
have you asked them, Kamala? Have you asked them why they came?
Because of this fear only. People are moving from here and there. That's why they are also coming from there.
Why? You said that these friends or relatives of yours were living in Hyderabad, correct?
Yes, there's from last 4-5 years they are staying in Hyderabad. After lockdown.
Okay, and where are you based, Kamala? Which part of India are you in?
In Andhra Pradesh only, sir. In Andhra Pradesh.
You are in Andhra Pradesh. Okay, so you're saying Hyderabad is now Telangana, but they came to Andhra Pradesh. Is that right?
Yeah. Their proper their native place is Andhra Pradesh. Migrated to Hyderabad.
Okay.
From last 20 years, they settled in Hyderabad. But suddenly after this lockdown, with some private bus, they traveled from Hyderabad to. There is no purpose of their traveling. Because of fear only.
There is no purpose.
And I found those people cases like that.
Okay, you're right. And those people, I think, have not necessarily been well informed. They have not realized how important it was not to move. Okay.
Yeah, exactly.
So I
found many cases like that. That's why I raised that question.
No, you're right. And I think that's an important point that you raised. In such cases, I would say it is also the duty of the person to be informed about such issues before they decide to move.
Exactly.
Okay. So I fully agree with you, Kamala. No doubts. Anything else?
Thank you. Thank you.
Harishji, no problem. Thank you, Kamala, for coming in. Harishji, back to you.
Sir, thank you for the really wonderful session. And we think it was a great opportunity for our department to get a wonderful resource person like you.
And it was a great opportunity to come and join you. Thank you so much for having me. Very good. Look, I'm really looking forward to continuing these conversations. I'm very grateful for the opportunity. Thanks again to Principal Harish Kumar, to all the participants. I still see even after 1.5 hours, there are still 59 participants. So I have not done too badly. I have kept the attention of all of you. And that is always a good side of a webinar. In this day of webinars, it is easy for people to come and leave when they want to. But if we were in a closed room, perhaps you would not have left that easily. But this is great. I really appreciate this opportunity. Thank you very much also to Shrikala, who reached out to me in the first place. I think this is great, and we need to constantly be able to exchange information on these issues, particularly on the issue of migration. I really appreciate it, right? So thanks very much, Harishji. Thank you very much. I wish you all the very best. I wish all the students, I wish all the participants my very best. I have nothing further to add. Please go ahead.
So I hope that there is no other questions. Thank you, sir, for clarifying all the doubts. Let me invite trainee social worker Shrivin Xavier for delivering vote of thanks.
Good afternoon to all. As all good things come to an end in life, so is the webinar. On behalf of PG Department of Social Work, Sri Shabarisha College, I take this opportunity to propose vote of thanks to those who directly and indirectly contributed to the webinar on migration and development, impact of COVID-19 among migrants, organized by our college, associated with LANDAID, the Social Work Students Association. At the outset, I thank our chief guest and resource person, Mr. Shabadinath Nair, Labor Migration Specialist, South Asia. We are really enlightened with your knowledge and presence. Thank you, sir. Next, I would like to thank our principal, Professor V.G. Harish Kumar, for his enthusiastic support. A special thanks to the organizing committee, teachers and students for their unflinching. Our heartfelt thanks to our participants for active participation. With these warm words and a key message, we move to the end of today's webinar. Thank you. Thank you all.
Thank you very much.
Thank you, Sabri sir. Thank you. Hope see you in future. Okay.